All right, today we're diving into a pretty radical idea from the Wounded Healers Institute. It's this: what if our mental health and legal systems are fundamentally broken? What if we've been trying to fix the individual this whole time when the real patient is the system itself? So let's just start right there with that central question. What if the very systems that we design to provide care and justice are themselves sick? It's a bold premise, for sure, and it totally flips the script on how we usually think about mental health and public policy.
And this quote just lays it all out, doesn't it? The argument we're about to explore is that the dysfunction we see all around us isn't just a bunch of individual problems. Nope, it's actually a symptom of a much bigger issue, a fundamentally disordered system.
So, to really get a handle on this argument, we got to start with the diagnosis. According to the source material, what exactly is supposed to be wrong with the system? Let's take a look. Okay, and here's the core diagnosis: a state of arrested development. The argument is that our big institutions, the legal system, the psychiatric system, are basically operating with the reasoning of a child. Rigid, super rule-bound, and just unable to grasp complex realities. And this slide really breaks that down for us. On one side, you've got mature adult logic. It can handle nuance, it thinks about morality. But on the other side, that's the system's logic. It's all black and white, totally focused on rigid rules and getting rewards. And this is why it kind of short-circuits when it's faced with conflicting info, like when science and law just don't see eye to eye. And like any patient, this system has its own compulsions. The source material calls them positive addictions. Now, these are things we normally think are great: perfectionism, altruism, ambition. But in this framework, they're seen as the system's core compulsions, driving it to care more about control and its own reputation than about people's actual well-being. Now, this is a huge piece of the puzzle. The claim is that the Bible of psychiatry, the DSM, is fundamentally incomplete. It apparently lacks clear, usable definitions for really core concepts like addiction, dissociation, and the unconscious. That creates this massive blind spot, which means the system is literally trying to treat conditions it can't even properly define. So, if the old definitions are broken, then what? How does this source material suggest we redefine the problem? Let's get into this new framework. Okay, this right here is the cornerstone of the whole thing. Addiction gets reframed. It's not a moral failing or just a disease, it's an act of dissociation. Think of it like the mind's emergency exit. It's a survival strategy. You mentally check out, you disconnect from your pain, all to cope with trauma that's never been resolved. And where does that trauma live? Well, the argument here is that the body itself is the unconscious mind. Trauma isn't just a bad memory stuck in your head, it's a physical thing, a somatic imprint that gets stored in our nervous system. So what that means is, to heal the mind, you absolutely have to work with the body. And see, this brings us right back to those positive addictions. When a drive for perfection becomes compulsive, obsessive, it's not a virtue anymore. The argument is that it's the exact same underlying mechanism as any other addiction. It's an attempt to manage all that internal pain by controlling the external world. Okay, so if the system is sick and our definitions are flawed, who's supposed to guide us toward healing? This is where the source introduces this really powerful idea: the archetype of the wounded healer. And in this worldview, a healer isn't someone defined by their degrees or licenses. Not at all. Their authority comes from lived experience. They're wounded because they've been through their own trauma, and they're healers because, just like the quote says, they know the way back. They've walked the path themselves. And this is the critical difference in how they operate. The system runs on what's called legal ethics, a code that's all about rules, compliance, and protecting the institution. But the healer, they operate from moral ethics, putting their conscience and what's genuinely right for the individual first, even if it means pushing back against a rule. So you can see how this creates this profound conflict, right? What's legally required of a professional might feel totally wrong, morally, and what feels morally right might get them in trouble, violating their code of conduct. The source calls this a moral inversion, and it's presented as the key reason why an alternative like the healer is so necessary. So what does this new path actually look like? If we're not using the old map, what are the practical tools that line up with this new way of thinking? The focus here is on therapies that work directly with the body and the nervous system to process that stored trauma. We're talking about things like EMDR and brain spotting, which help the brain reprocess memories, and also body-based stuff like trauma-sensitive yoga and mindfulness. These are all highlighted because they get to the root of the issue, instead of just trying to manage symptoms. And this brings us to another really key part of the prescription: psychedelic-assisted therapy. Take a look at this comparison between the conventional SSRI model and psilocybin. The differences are pretty staggering, right? Look at the onset of action, the duration of the effect. The argument being made is that this kind of therapy could be a much more powerful and maybe more effective alternative for deep, lasting healing. Now, the source makes a really crucial distinction here. It separates industrialized pharmaceuticals, which it calls drugs, from naturally occurring plants and fungi, which it calls superfoods. And this isn't just playing with words. It's about recognizing the psychological and, yes, spiritual value that these natural compounds have held in cultures for thousands of years. And really, that brings us to the final big question that this whole framework leaves us with. The argument is that healing is an innate human right. So if that's true, then the ultimate question is this: who gets to control it? Who has the authority to define what healing even is and to decide which paths are legitimate? It's a question that really challenges the very foundation of our current systems.